Go ahead.
Good evening, all. I welcome you all for the FB live session. This is Dietitian Flora. Today I'm going to talk about iron deficiency and anemia. I think you have been heard many other times like anemia. A number of times we have been, every time whenever we visit a doctor, first thing is which comes to an anemia. So let's talk about what is anemia and what are the symptoms, causes. And the important thing is what about the diet, which can is helpful for you for the to improve your anemia level. So let's talk about anemia. Iron is an important mineral that helps in the growth and the development of the body. Iron is the most important thing where it builds. It is used to the body to make as a hemoglobin. Okay, which carries oxygen throughout the body, which helps to the growth and development of our body. So it is a mineral that is the most important mineral which carries out the oxygen from the lungs to all the parts of the body, right from the tissues to the lungs. That is why iron is used to make the body as hemoglobin. Okay, so what is anemia? So anemia is a metabolic disorder where hemoglobin levels is less than 12 for females and 13 is less than in males. So whoever is less than is having anemia which is less than a 12, they are called anemic. They are patient with the anemic. And the males with less than 13 is like anemic. So always make sure you have to this will further reduce the amount of the red blood cells in the body. Okay, so you have a test like a CPP and which you have to check out with that. Through the blood test, you can know the value of the are you anemic or not. So always make sure to go for a test like CBP to know your hemoglobin level whether you are anemic or not. So it leads to reduces the oxygen flow in the body to the organs. Yes, as we have been seeing the symptoms like and let to know that the oxygen levels in the body where the symptoms, the main first symptoms, and to know the hemoglobin has been levels to diagnose the anemia are like as we are looking into the slide, the tabular form which has been shown by the WHO, according to the WHO, in the children. So it is like moderate and the mild and the severe and no anemic. So if it is less than 7, it is like in the children like around 5 to 59 months of age. If it is less than 11, if it is moderate is like 7 to 9, and the severity of it is 7. From the children to the pregnant and non-pregnant and the men, from the right from the birth, from the lifespan of our age, the iron is much important in our body, which makes a carriage to the oxygen. So that is why we need to check every time our iron level. So for the pregnant woman, if it is more than 12, it is like a no anemic. It is a normal range of the iron levels, and the moderate is like around 8 to 10, 11, and the severe, if it is less than 8, it is like anemic. You are anemic. So the non-pregnant woman and the pregnant woman is like less than, more than 11 is must, and less than 7 is the severity of the hemoglobin level. So men, it should be always greater than the 13, and if it is less than, the severity is less than 8, it is like you are anemic. So always make sure you need to be check of your levels, iron levels, and you to know whether you are anemic or no, you have to be on check. So causes of anemia, it's like blood loss, such as heavy menstrual and the bleeding or surgeries and accidents, mainly we have been seen in the women, and with a lot of bleeding of in the menstrual cycles, sometimes of the severe accidents and the surgeries with the loss of too much of blood loss. This is the main cause of the anemia, and insufficient intake of iron foods. Yes, this is the number one thing where we're going to talk about today is depending on the diet. What kind of a food are you taking? Are you taking the iron-rich diet? Are you? It is properly absorbed in the body that we are looking after, and not only low intake of the iron-rich foods can also causes the anemia, and ulcers. Okay, ulcers because of the ulcers in the body can also leads to a cause of anemia. Cancer is one of the major cause of the anemia, and regular use of some over the continuous pain reliefs, like it might be are using continuous medications, and too much of pain reliefs are you taking, which cannot be inhibits the absorption of the anemia. So let's see the symptoms of the anemia. So first thing is mainly what we know as a general knowledge, according to our knowledge, is like brittle nails and spoon-shaped nails as being have been seen from our childhood, as being been studied from our childhood. So we know that spoon nails and also the brittle nails, as we all know from our childhood. So apart from those two symptoms, we have to know about the tiredness. Yes, because of the low levels of the oxygen, which does not carry proper oxygen to the lungs. That is why the hemoglobin, the iron is the main thing where with the iron, the oxygen carries to the from the lungs, from the, to the all the parts of the body and to the tissues also. So it is like if it doesn't have proper oxygen in the body, we feel easily tiredness, painless, and the shortness of breath. Yes, mainly we have been seeing the symptoms of walking too much of together, and we have been less. Walking to the too much of together, and we have been number of the kilometers. If we see, we have to be noticed to that of significance, that the shortness of breath. The main symptoms we have to be look into, like how what kind of breathing issues you have. If you are walking for a half a kilo, or if you're going for up the stairs, and we are walking for 10 minutes or 5 minutes. If you are feeling tired and if you're having shortness of breath, that it is the number one symptom of hemoglobin. So if you have having that kind of a symptoms, make sure you go for a test and to know that whether you are anemic or no. So frequent headaches. Okay, frequent headache is the number one. Also, where we with the no proper sleep, tiredness is also cause the symptoms of a headache, and dizziness, regular cramps in our legs, and difficulty in concentrating. As we are looking into this picture, this says as irregular heartbeat, the chest pain, the cold hands, yes, and fatigue, sweat, headache, and yellowish skin, insomnia, and leg cramp, dizziness. These are all the symptoms where you have to be on check if you are facing with these symptoms. Okay, and the next is like who can susceptible to the anemia, like who are the persons to know which who can causes to these symptoms, and to who are being suspect to know well. It is like women only, because they tend to lose loss of blood during the menstruation cycles. So if you are having like overflow of the cycle, if you're over bleeding up, you need to check where what is the problem in that, and you have to consult a doctor. Okay, and a pregnant woman who skips a multivitamin with the folic acid and iron, pregnant woman is for the woman who always we gives a high folic acid and iron rich diet, because it's a placenta where it absorbs too much of iron there. So always with we always check for the pregnant woman, it should be like about the 12 of the percent of the hemoglobin. So below 8, it is a severity where she has to take in other supplements and add it up, and also increase in the diet. And people who are above 65, yes, and diet low in iron and B12. Also, not only the iron-rich foods which plays an important role, but also the other vitamins and minerals with the vitamin B12 and folic acid and iron, calcium. Everything is most important minerals where we have to be include in our daily diet. And not only with this, and also to the other chronic conditions, like it might be a cancer, a kidney patients, or a low immunity, or any kind of inflammatory diseases can also be prone to the anemic. Okay, people who are repeatedly donated with any adequate time gap. Okay, you need to check your iron levels before you donate it back to back again immediately without any time gap. You have to increase, at least you have to wait for at least 6 months later on. You can donate the blood, but not immediately adequate in adequate times of intervals. Okay. Next, we are going to look into the treatment. The major part and the important part in the diet is like what kind of a foods to be included and how to treat anemia by a balanced diet. Always, I talk about a balanced diet and nutritious diet is a key where it can prevent the anemia. Okay, where not every time you take a supplement and you can gain the iron levels to improve the iron levels, but always a balanced diet, a proper iron rich diet which can all be helpful always to improve your iron levels in your body. So the best diet plan for the anemic includes iron rich foods and other essential hemoglobin are also being RBC productions in the blood. So always to see a part of the nutrient where you have to absorb the iron levels, where it is most important thing where should help your body. Absorption is most important than better. So there are two kinds of iron. Two types of irons in the foods, okay, where you to look into it and you have to follow these two types where it is easily absorbed in the body, where we have two types of irons in the foods where it is like heme iron. Heme iron is found only in the animal product, like it is mostly found in the animal products, meat and meat products, where it is found mostly in the meat, poultry and seafoods, where in the picture has been mentioned like so many sources of heme iron sources, like it might be a lamb, a mutton at a good source of heme iron levels, okay, and the oyster, the fish, and also it is a more, it is the absorption is a complete absorption will be there in these heme iron products. So where you have to include not only the lean and all the liver, which plays an important role, where you have to include in the daily diet if you are having a low level of anemia, iron values. So non-heme, it is mostly found in the plant sources, okay, where the foods are fortified with the iron. So only on the non-heme is based on the plant-based sources where you get from the green leafy vegetables, nuts, raisins, and all chocolates, where you get a non-heme iron, and heme iron is found in the animal-based products. So where you have to include both plays an important role. Both iron food, where a heme and non-heme both plays an important role to improve the iron levels in the body. Foods to eat in the iron deficiency is the most important, where as I have been telling before the slide, like heme and non-heme. Apart from that, let me see like organ meat, where I was talking about organ meats, like it should be liver, kidney, as also mutton liver is a plays a important role, where you can include all the organ meats, which is the number one highest range of the iron level, where you can include in a daily diet. And the seafood, as we have been looking after, like oyster, the fish, a good fatty fish, where omega-3 fatty fish, where you can include it. The fortified foods, where any kind of fortified cereals, sort of fortified pulses, where you can include it. The beans, all kinds of beans, where it might be a chana, rajma, choli, all those beans also can be included, whether in the form of dal, either in the form of roasted ones, whether in form of the sprouts, any kind of recipes can be included. But every day you have to include from the all the different food groups, where you have to include to improve the iron levels in the body. With the nuts and the seeds, yes, nuts and seeds also, which has a number of vitamins and minerals, which also zinc, copper, which plays an important role to increase the amount of the iron levels. The nuts can be included like almonds, walnuts, and the dry dates is raisins, and the seeds like pumpkin seeds, watermelon seeds, flax seeds also gives you a number iron levels, which can also be absorbed back to the daily diet. So meat and meat poultry, like where the meat is number one. Again, mutton, where the lamb, you can include it, whether in the form of soup or the broth kind of soups, as well as the poultry, where the chicken, also the eggs, which you can include the egg yolk also. It is important to improve the iron levels in the body. Where again the green leafy vegetables, as we all know, as we've been hearing about all these things every day, we have been eating that. To know it, what foods to be included is most important. Like right from the meat and meat products, right from the vegetables, or from the beans and fortified, everything should be every food has some amount of the iron rich content in their properties. So we have to add up every day from the different kinds of food groups, where you have to include it. And not only eating it, but absorption is most important, where you have to see around. So the foods iron the inhibits, like the tannins, where the tannins which is found mostly tannins found in the tea and coffees, where you cannot immediately have before or after the food which you are taking around. So these are the iron inhibitors, where that blocks the iron absorption. So okay, always we tell not to have a coffee or a tea immediately with your meal. Okay, if you are having too much of, as we have been seeing, like people around, whenever they have the breakfast, they immediately have one cup of a tea or a coffee with that, where it inhibits or it blocks the absorption of the iron, where the tea and coffees which cannot be included. As we have been seeing, like in olden days, mostly not only here apart from India or China, we have been seeing. So they'll be taking around wheatgrass water kind of, either they have a green tea or a moringa tea or in the kind of that. So you can include a lemon water with that instead of having a tea or coffee. Lemon is a vitamin C plays an important role in the absorption, where you can include the lukewarm water with the lemon, which really helps in the absorption, but not tea or coffees or any kind of beverages, like any kind of soft drinks which has no where we have to tell no to those beverages and all. So oxalates, which is most present in the again the tea and coffees, it is present, and the high calcium rich foods, immediately taking after any kind of iron rich foods, but the high calcium rich foods, which has to be avoided, because their absorption, and again it blocks the iron absorption there. So make a check of like what kind of iron rich foods in all the iron rich foods mostly present in milk and milk products. Not only milk and milk products, we have been some amount of in the moringa, and as well as still the sesame seeds and the almonds also has the iron, calcium rich foods, where you have to not take immediately with these iron rich foods, but not before or after, at least half an hour or 1 hour break. Then later you can have these high calcium rich foods and tannins and oxidants. And the phytates, which are the phytic acids, which is mostly present in those beans, where the pulses, okay, the pulses, where you have to soak it, germinate it, and then you can prepare those phytate-rich foods, where mostly present in those the pulses, where you can soak it and over the night, and you can drain the water. Then later on, you can cook for yourself, or germinate it and you can cook for yourself. Where which is really plays an important role in absorption, but not direct cooking. To that blocks the iron absorption. So always soak it, germinate it, and then cook it. So oxalic acid, where again, which is mostly present in the again the same the pulses and the cereals, where you have to soak it and you can use it for the next time. So how to boost the iron absorption in the body? So always make sure to boost up the iron absorption in the body. It is, plays an important role, which is must, you have to know it around the carrier of the heme. which is a protein component. Okay, the heme, as we are looking into, we have been see the previous slide, the heme iron, which we get only from the animal production, where the animal product, where meat and chicken, eggs, where you get, that is the important. You have to take around the protein component where it is present more a high number of iron levels as well as the protein content in that, where you have to take mostly not depending on a non-heme foods, but mostly iron absorption will be good and enough heme iron content. So always choose animal production products where you can include the more better absorption more than a non-heme foods. So best on eating empty stomach, where always make sure if you're taking any kind of iron-rich foods, always choose in an empty stomach where it gets directly absorbed. The iron levels may raise up immediately in a very shorter time period. So always use lemon juice, whether vitamin C is must important, whether not only a lemon juice, any kind of bell peppers or orange, kiwi and all, where you can, and Indian gooseberries, I mean, where we call it as amla, it is high rich in the vitamin C. It always make sure the iron rich foods, whether if you're preparing any kind of green leafy vegetables, where you can add a few drops of lemon juice, or else having a a fruit like high vitamin C rich food immediately after your lunch dinner, where you can include for the better absorption of the iron. So folic acid plays also major part, important role where to improve the iron levels. Always, if you're having the low levels of iron, you have to include like folic acid, as we were talking about, and vitamin C and B12 is must. B12, where we found mostly in the again animal products, where you can include like all those eggs, chicken, meat, and all, where you it is high number of B12. So you can include all this. So avoid iron blockages, like as I was talking about, where you have to the foods to be avoided, like high tannins and then high calcium levels, where not immediately with your main meals, but you have to avoid mostly with these like blockers, which hinders not to absorb the iron levels, where you have to hinder that iron absorption in the intestine from the intestine. So look, like it would be like coffee, alcohol, any kind of beverages I was talking about, and mostly cook in the iron levels. Mostly we will be seeing like cooking in the iron vessels. It is the most important part where the iron content will be there in that. So always cooking in the iron vessels will also plays an important role where you have to be, and always make sure with the less shorter period of cooking time. So make sure you have to be check for the not cooking for the longer time, where the vitamins and minerals get disappeared. So it is not the way of cooking. So always choose a shorter time. Always make sure you cook on a iron vessels, but not on a steel ones. So and the daily recommended allowances for where how much we need according to the recommended allowances according to the ICMR. Okay, so the above the 18 years man should be like more than like RDA. It is around 17 mg per day, and 18 years like adult woman is like 21 milligrams per day, and the pregnant woman is 35, and the lactating woman, the pregnant woman who is breastfeeding, is about 25 mg per day. So this is how where you have to take around if you are anemic and if your iron levels are low. This is a recommended dietary allowances of iron where you have to meet per day. So make sure right from the above 18 to the children, we have been looking into this slide. So as the woman, we are like adult woman, so you have to check around, are you taking around 21 mg per day, or if you're pregnant, it is 35 mg. If the men, not only women, but also men, iron is the most important, which plays an important role in the life. So make sure if you take a daily recommended uh, mgs per day, you have to, if it is not sufficient by the diet, you have to include the supplements if you have to. meat. These are the daily recommended allowances where you have to take it every day. So points to remember that where the make sure you have to eat iron-rich foods along with the foods, not the beverages that blocks the iron as the absorption what I was talking about. First of all, make sure that you always do not eat immediately or drink or tea or coffee immediately after you eat it. So do not have the iron blockages absorption with the coffees or tea or the high oxalate, high calcium rich foods or high tannins. These are all the foods where you have to include immediately when you have iron rich foods. So eating iron rich foods with the vitamin C for the better absorption. Yes, iron rich foods which with the vitamin C for the better absorption, that plays a major role. So that iron-rich foods I was talking about with the vitamin C again, oranges, tomatoes, strawberries, Indian gooseberries, orange, kiwi, and all you can lemon to improve the absorption of the iron. So eat an iron-rich food which can contains beta carotene. Yes, it is beta carotene will also helps to the more absorption to improve the absorption of the iron, such as apricots, red bell peppers, and the beets, the beetroot, which can always will be uh, doctors or dietitians will be recommending you to have green leafy vegetables or a beetroot or carrots to improve the iron levels. So these are the things where you have to remember like what kind of a foods to be included. So this is how you have to always remember the points to always should not have immediately a tea or coffee with the meals or should increase the vitamin C and you have to increase the beta carotene. Always consume a heme and non-heme as we have been seen in the previous slides where plays an important role to improve the iron levels in the body throughout the day. You have to either heme and non-heme both gives you numbers where you iron levels will improve. Where you can be preparation is important, like how you prepare it. If you want to heme and like if you want to add up meat with any green leafy vegetables, that plays a double role where it increases the absorption of the iron. So make sure the preparation either you want to have with the chicken with any green leafy vegetables or any kind of vegetables with any non-veg part you are adding them, that is also as a better absorption where you can include the iron rich iron levels in the body. So eat heme and non-heme foods together, like which increases the more of iron absorption in the body. So this is how where I've been talking about the iron rich foods is the most important. Iron is a major part of the role where you which carries the oxygen levels where as we have been seeing the like what kind of severity it is like how, with what kind of anemic you are. Do check your anemic levels and iron levels and make sure that you are anemic or no. And also the recommended daily allowances also we have been seeing almost like 20 to 25 about 17 where you have to take not only through the diet but also supplement also plays an important role where you have to add not only a diet but how severity you have to know about and you have to but not every time where we take a supplement but diet is all the time where you can include and add up every day where to improve the iron levels. So this is the nutrition is not about just a learning, it's about learning about learning to live. So always should learn to live but not to eat around it. So any kind of queries you have, please share with us so that I'm going to answer it around. So we have in a question like what food items contains iron in good proportions like see as I was talking in the slide where you have to include like heme and non-heme plays better gives you a more amount of the iron content. So you have to include like meat products where not only meat like chicken, meat, eggs. Not only that, but also you can include green leafy vegetables and pulses, cereals. also plays an important role, where you can improve the iron absorption, where you can add up heme and non-heme together, also which gives you a content of more improvement of the iron levels. So we have an other question, like how to treat iron deficiency anemia. So as not treating iron deficiency, first we have to know like how much severity you have. Um, make sure you have to check through the blood test like CBP, and also we can treat iron deficiency through the diet. Okay, if it is more severity, you have to go consult a doctor and add up the supplements. Okay, it might be in the form of tablet form or a syrup, or through the injections intramuscular. So we have to be on check that. Now treating is through the diet as well as supplement. Okay, so good amount of iron-rich foods where you have to include, and but with the supplements also help you to treat the iron deficiency anemia. How long how does it takes to treat the iron deficiency anemia? So it depends on the severity. Again, you have at least 3 months where it takes to improve your levels of your anemia, iron levels in the body, where with the again supplements as well as the food plays an important role to treat up according to your severity, where you have to consult your doctor again, and you have to have through the supplements by through the diet, which can treat up to like around 3 to 4 months. You can improve your iron levels. Is there any symptoms for the iron deficiency? Yes, we do have, as I was talking on the previous slides, like shortness of breath, brittle nails, spoon kind of nails we have. So cold hands, headaches, fatigue, all these are the symptoms where we've been seeing in the iron deficiencies, where you have to know about the symptoms, and if you're getting easily shortness of breath, where you have to consult a doctor and keep on check of your iron levels. Thank you all. What foods to avoid if you are anemic? So as I was talking about, foods to be avoided, like more high in calcium, as well as tannin rich foods, where the blocks, and with inhibits the absorption of the iron, where not like tea or coffees, or high calcium rich foods, or high you know, all these the foods where you have to avoid it immediately after taking those iron rich foods. Not you have to check whether it is not before or after half an hour of the food intake, but not immediately. You have to be in check. So high amount of tannins, oxalates, these are the high calcium rich foods where you have to avoid. Not immediately before the meals, but you have to take a break and then you can avoid. You can have. So any other questions? I think we have no other queries there. So I thank you all, and I take care till then. I'm going to come up with another topic. Take care and be safe. Thank you.